Today, we're breaking down 13 of the most common reasons for lower abdominal pain, what they mean, what to do, and when to see a doctor. Let's dive in. First up, urinary tract infections or UTIs, super common, especially in women. UTIs happen when bacteria enter the urinary system, causing pain, burning, and a constant urge to pee. Other signs: cloudy or bloody urine, strong odor, and sometimes fever or fatigue. See a doctor as soon as you suspect a UTI. Antibiotics are needed, and untreated UTIs can lead to kidney infections. Prevent UTIs by staying hydrated, wiping front to back, and urinating after sex. Irritable bowel syndrome, or IBS, is a frustratingly common condition. It's classified as a functional gut disorder, meaning there's a problem with how your digestive system works. It can significantly impact your daily life, making it difficult to plan activities or even just feel comfortable. Understanding what IBS is and how to manage it is the first step towards feeling better. What makes IBS tricky is that, despite the discomfort, your intestines often look perfectly normal in tests and scans. There's no visible inflammation or structural abnormality. However, the gut simply doesn't function as it should, leading to a range of unpleasant symptoms. The signals between your brain and your gut might be misfiring, causing the muscles in your intestines to contract too much or too little. The hallmark symptom of IBS is lower abdominal pain. This pain can range from a mild ache to severe cramps, and it often comes and goes. It's frequently related to bowel movements, either improving after going to the bathroom or worsening beforehand. Bloating and gas are also extremely common. You might feel like your stomach is constantly distended, tight, and full of air. This can be incredibly uncomfortable and embarrassing, and of course there are changes in bowel habits. This is where IBS gets its name, as the bowels are often irritable and unpredictable. These changes can manifest as diarrhea, constipation, or even a frustrating mix of both, sometimes alternating between the two. The inconsistency can make it difficult to manage daily life. What triggers these symptoms? Unfortunately, it varies greatly from person to person. Certain foods are common culprits. Stress is another major factor. Periods of high stress can exacerbate IBS symptoms, and hormonal changes, particularly in women, can also play a significant role in triggering IBS flare-ups. So how do you manage IBS? A key step is tracking your triggers. Keeping a detailed record of what you eat, your stress levels, and your symptoms can help you identify patterns. Adjusting your diet is often necessary. Many people find relief by trying a low FODMAP diet, which limits certain types of carbohydrates that can be difficult to digest. And actively managing stress through techniques like yoga, meditation, or deep breathing exercises can make a big difference. While there's currently no cure for IBS, remember that lifestyle changes can significantly improve your quality of life and help you manage your symptoms effectively. Remember, consistency is key. Keep a detailed food and symptom diary to help you spot patterns and identify your personal triggers. It's crucial to get a proper diagnosis from a doctor. This is important to rule out other, more serious conditions that might be causing your symptoms. A doctor can also provide guidance on managing your IBS and recommend appropriate treatments. Constipation is when bowel movements are infrequent or hard to pass, causing pain and bloating. Common causes: low fiber, dehydration, lack of exercise, and some medications. Prevention: eat more fiber, drink water, and stay active. Don't ignore the urge to go. Train your body with a regular routine. Most cases resolve with simple changes, but see a doctor if constipation is severe, lasts over 3 weeks, or comes with blood or weight loss. Constipation is uncomfortable but usually manageable. Gastroenteritis, often referred to as the stomach flu, though it's not actually related to the influenza virus, is a common ailment that can disrupt your life. It's an inflammation of the digestive tract, primarily affecting the stomach and intestines. This unpleasant condition is usually caused by viruses, such as norovirus or rotavirus, or bacteria like Salmonella or E. coli. These microscopic invaders wreak havoc on your digestive system. The culprits are often lurking in contaminated food or water. Think norovirus outbreaks on cruise ships or food poisoning from undercooked meat. Improper food handling and hygiene can significantly increase your risk. Symptoms hit fast and can be quite intense, often appearing within 12 to 48 hours after exposure to the offending pathogen. You might feel perfectly fine one moment and then suddenly be struck with a wave of nausea and discomfort. The most common symptoms include diarrhea, which can range from mild to severe and may be accompanied by abdominal cramping. Vomiting is another hallmark symptom. and it can be persistent and debilitating, making it difficult to keep down food or fluids. You'll likely experience abdominal cramps, adding to the overall discomfort, and sometimes a low-grade fever may develop as your body fights off the infection. The biggest risk associated with gastroenteritis is dehydration from fluid loss due to diarrhea and vomiting. This can be especially dangerous for young children, the elderly, and individuals with underlying health conditions. The best course of action is to rest, allowing your body to recover, and sip clear fluids like water, broth, or electrolyte solutions to replenish lost fluids. Consider using oral rehydration solutions if needed, especially if you're experiencing significant fluid loss. These solutions contain electrolytes that help restore balance in your body. It's wise to avoid caffeine, as it can further dehydrate you. Also, steer clear of alcohol and sugary drinks, as these can irritate your stomach and worsen your symptoms. In most cases, gastroenteritis will clear up on its own in a few days with proper rest and hydration. However, it's crucial to seek medical help if you can't keep fluids down, as this can quickly lead to severe dehydration. Watch out for signs of severe dehydration such as dizziness, decreased urination, and a rapid heart rate, and seek immediate medical attention. A high fever is also a cause for concern. The presence of blood in your vomit or stool is another red flag that warrants immediate medical evaluation. Remember, staying hydrated is key to recovery. Give your gut the time it needs to heal, and you'll be back on your feet in no time. Menstrual cramps are a common cause of lower abdominal pain for women, caused by uterine contractions during your period. Pain can range from mild to severe and may radiate to the back or thighs. Over-the-counter pain relievers and heat therapy help most women. Regular exercise and stress reduction can also ease symptoms. If cramps suddenly worsen, don't respond to medication or come with other symptoms, see your doctor. Most cramps are normal, but severe pain could signal another condition. Ovarian cysts are fluid-filled sacs on the ovaries. Most are harmless and go away on their own. Larger cysts can cause dull or sharp pain, bloating, or pressure, usually on one side. Sudden, severe pain or pain with fever, vomiting could mean a ruptured cyst or ovarian torsion. Seek emergency care. Most cysts just need monitoring, but birth control may help prevent new ones. Regular checkups are key for women with recurring symptoms. Don't ignore sudden or severe pelvic pain. Appendicitis is a medical emergency. Pain starts near the belly button, then shifts to the lower right abdomen and worsens other symptoms. Loss of appetite, nausea, vomiting, and low fever. If untreated, the appendix can burst, causing life-threatening infection. Don't wait, go to the ER if you suspect appendicitis. Diagnosis involves exams, and imaging treatment is usually surgery. Quick action saves lives. A hernia happens when tissue pushes through a weak spot in your abdominal wall, often causing a visible bulge and pain. Most common in the groin, inguinal hernia, especially in men. Pain worsens with lifting, coughing, or straining. See a doctor for any new lump. Hernias don't go away on their own. Sudden severe pain, nausea, or a discolored bulge means possible strangulation. Get emergency help. Surgery is often needed to repair hernias and prevent complications. Kidney stones are hard, crystalline mineral deposits that form within the kidneys. These formations can vary significantly in size, from tiny grains of sand to larger pebble-like structures. The presence of kidney stones can cause severe wave-like pain, often described as one of the most intense types of pain a person can experience. This excruciating discomfort arises as the stone attempts to move through the narrow urinary tract. The pain is typically felt in the back, side, or lower abdomen as they move, radiating outwards as the stone progresses down the ureter. This movement can cause spasms and irritation, intensifying the sensation. Other symptoms associated with kidney stones include blood in urine, a condition known as hematuria. The presence of blood can change the urine's color, ranging from a faint pink to a dark red. Furthermore, individuals may experience nausea, vomiting, as the body reacts to the intense pain and the disruption of normal kidney function. These symptoms can further weaken the individual. Kidney stones can also lead to frequent or painful urination, a condition called dysuria. This occurs as the stone irritates the bladder and urethra, causing a burning sensation during urination. Dehydration is a major risk factor in the development of kidney stones. When the body lacks sufficient fluids, the concentration of minerals in the urine increases, making it easier for stones to form. Therefore, drink plenty of water throughout the day to help prevent the formation of stones. Adequate hydration dilutes the urine, reducing the concentration of minerals and making it harder for crystals to form. Diet changes may also help in preventing kidney stones, depending on the specific type of stone. For example, reducing the intake of oxalate-rich foods may be beneficial for individuals prone to calcium oxalate stones. In many cases, most small kidney stones will pass on their own, without requiring medical intervention. This process can take several weeks, and pain management is often necessary during this time. However, some larger stones or those that cause significant obstruction may need medical intervention to facilitate their removal. Various treatment options are available depending on the size and location of the stone. It's crucial to see a doctor immediately for sudden, severe pain in your back or abdomen, as this could indicate a serious kidney stone issue. Prompt diagnosis and treatment can help prevent complications. Seek immediate medical attention if you experience urinary retention, meaning you can't pass urine, as this could indicate a complete blockage of the urinary tract, a potentially dangerous situation. Ultimately, prevention is all about maintaining adequate hydration levels. Drinking enough water is the simplest and most effective way to reduce your risk of developing kidney stones. PID is an infection of the female reproductive organs, often from untreated STIs like chlamydia or gonorrhea. Symptoms include lower abdominal pain, abnormal discharge, bleeding, pain during sex, fever, or painful urination. Untreated PID can cause infertility, ectopic pregnancy, and chronic pain. Early treatment with antibiotics is crucial. See a doctor if you have symptoms. Partners should be treated too to prevent reinfection. Practice safe sex and get regular STI screenings. Endometriosis is when tissue similar to the uterine lining grows outside the uterus, causing pain, especially during periods. Pain can also occur during sex, bowel movements, or urination, and may worsen over time. Other symptoms include heavy periods, fatigue, digestive issues, and sometimes infertility. Diagnosis can be tricky. Laparoscopy is the gold standard. Treatment includes pain meds, hormone therapy, or surgery. Work with a knowledgeable doctor for a personalized plan. Don't ignore severe or persistent pelvic pain. Diverticulitis is when small pouches in the colon become inflamed or infected, causing persistent pain, usually on the lower left side. Other symptoms: fever, nausea, vomiting, and changes in bowel habits. Treatment: antibiotics and a temporary low-fiber diet. Severe cases may need surgery. High-fiber diets help prevent future flare-ups. See a doctor for sudden, severe, or persistent abdominal pain. Early treatment prevents complications. Food intolerance is when your gut can't digest certain foods, causing pain, bloating, gas, or diarrhea, different from a food allergy. Common culprits: lactose, gluten, caffeine, and FODMAPs. Symptoms usually appear a few hours after eating the trigger food. Use an elimination diet with a doctor or dietitian to identify triggers. Main treatment: avoid or limit the offending food. Enzyme supplements can help with lactose. Keep a food journal to track symptoms. That's 13 common causes of lower abdominal pain, some simple, some serious. Listen to your body, don't ignore persistent or severe symptoms, and see a doctor when in doubt. If you found this helpful, like and subscribe for more health tips. Stay healthy and see you next time.